Okay, hi, we're chapter 11 and we are talking about health reform in the United States and we're supporting the uninsured Hispanic population in Dallas County. I'm Gabby Montoya.
I'm Sarah Lyons.
I'm Autumn Love.
I'm Sanjita Sharmishta.
And I'm Katie Sander.
So here's our policy analysis. So our client is Hispanic/Latino population in Dallas County, Texas. Many face barriers like limited English language resources, low income employment without insurance benefits, and a complicated health care system that is not easy to understand or access. We identified that lack of awareness and access to bilingual guidance and programs makes it so that Hispanic people have a hard time having insurance. So our problem statement, the problem that we are addressing is the persistent lack of accessible and culturally responsive health insurance enrollment support. When forms, websites, and assistance are in English, Spanish-speaking families face confusion or delays, which leads many to stay uninsured. This lack of support increases emergency-only healthcare use and worsens preventable health outcomes, which leaves families financially vulnerable. So by addressing this disconnect, we can help close the coverage gap and support the health of this community. So our background, around 1 in 5 adults in Dallas County are uninsured. For Hispanic working age adults, the uninsured rate is approximately 31%. This indicates a severe disparity. So key contributing factors are many in this community work in jobs without employer-provided insurance and face language barriers when navigating forms or websites that are mainly in English. Because this rate remains high, it is a systematic problem that demands intervention if we want to reduce health inequities and improve access to preventative care. So previous programs, Unidos US launched a bilingual campaign during the 2022 open enrollment period to encourage eligible Latino adults and children to enroll or renew insurance coverage. MHP Salud's Navigator program uses Spanish-speaking community health workers to assist with insurance application, renewal, and outreach. MHP Salud reported that nearly 80% of adults with children who use their application assistance services were approved for Medicaid. So although these programs are successful, they have not been scaled widely to Dallas County's large Hispanic uninsured community. So because Texas continues to lead the nation in adult uninsured rates, and the longer the gap persists, the more established the disparities become.
So when analyzing the landscape within the Dallas County population about who are affected by difficult to navigate programs due to language barriers and lack of access or lack of awareness, there are two main groups that are impacted by pre-existing policies and hurdles. These stakeholders include the Hispanic and Latino residents and community health workers. The Hispanic and Latino population are directly impacted by language access and health literacy when enrolling in coverage. Many individuals within this population can't speak fluent English, so it makes it difficult to navigate these systems, which leads to high uninsured rates and even delaying necessary health services. The second main stakeholder within Dallas County is the community health workers who directly help or treat the Hispanic and Latino residents with their specific needs. Many of the current policies in place don't effectively fit the needs of the Spanish-speaking population by not having bilingual, easy-to-navigate resources. Because these policies in place limit the community health workers' duties and obligations for bilingual support, navigation, it negatively impacts Hispanic Latino individuals with prolonged delays in care. Because of the limited power of the Hispanic Latino population with bilingual inclusion, insurance navigation, and funding, the focus shifts to the trusted community health workers and other community leaders for major decision making and funding. Because these various community members are the most trusted and can supply resources, they can support innovations to address these challenges with language barriers and high uninsured rates in the county.
Okay, so these are our two options for supporting the uninsured Hispanic population in Dallas County, and they're based on existing policies we found to be successful in other areas of the country. So the first one is Bridging the Health Equity Gap Program, which started in 2015 in Providence, Rhode Island, through the Clinica Esperanza Hope Clinic, which is a nonprofit free clinic for uninsured adults. This program focused on reducing health inequities among patients with chronic diseases by offering lifestyle interventions, They provided chronic disease education classes and one-on-one health coaching sessions, and the results were impressive as participants saw a significant decrease in blood glucose levels, improvements in metabolic biomarkers over 6 and 12 months, and a 91% retention rate. And then our other option is the Kids Help Intervention Program, which was also founded in 2015. This was a pilot program that trained Latino parent mentors to guide other parents in navigating insurance coverage for their children. The mentors provided information on available programs like Medicaid and helped bridge language and communication barriers. And then as a result, 95% of Latino children assigned a parent mentor obtained health insurance through this program. So option 1 analysis, this is for bridging the health equity gap program. Some of the strengths we saw was that it targeted uninsured Hispanic populations. It combined group education with personal coaching, demonstrated measurable health improvements, which was lower blood glucose and better biomarkers for this one, and then a high participation retention rate of 91%. The weaknesses was that it focused mainly on adults. It requires trained health coaches and ongoing funding, and the success depends on sustained community participation and trust. And it also, may face challenges scaling this to a larger community such as Dallas County. Option 2 for the Kids Help Intervention Program analysis. Some of the strengths we saw that it also focused on uninsured Latino children. It used Latino parent mentors, which increased trust and relatability between the community and these mentors. It addressed language and communication barriers, and there was a high success rate as 95% of the children obtained health insurance. And then for weaknesses, it was a small pilot study, so we're not sure that we can scale it to Dallas County as it's much larger. And then it's extensive training for mentors and a lot of supervision throughout the program. Lots of funding because it's resource intensive to sustain, and the impact varies depending on mentor commitment.
So we're recommending the Bridging the Health Equity Gap program. We believe that the strengths of this program highly outweigh the weaknesses and is the program that is most likely to succeed. One of the biggest strengths is that it already targets the uninsured Hispanic population while combining education with personal coaching. However, we would like to tweak the program a little bit because the program not only focuses on adults, but it focuses on metabolic biomarkers and blood glucose levels. We would instead put our focus on complex insurance terminology, knowledge of insurance plans, and have mentors help through the challenging insurance systems. But overall, this program had high success rates, which is why we think it will be most beneficial.
So for our advocacy plan, our goal is to help increase the health insurance enrollment rates along with insurance navigation for the Hispanic and Latino residents in Dallas County. By launching a similar program to Bridging the Health Equity Gap model in Rhode Island, this will help the population by providing free bilingual health insurance access and effective coaching programs to ultimately lower uninsured rates within a year.
Okay, in terms of our objectives for this advocacy plan, we have short-term objectives, which include securing funding, securing a location for the classes and the mentor meetings, partnering with local communities to develop those bilingual pamphlets and resources, and recruiting and training the first group of bilingual mentors to assist those uninsured populations. In terms of long-term goals, we want to recruit a significant population of uninsured Hispanics in the Dallas County, and then advocate for funding and community partnerships to help make the program better. And then we would also like to evaluate the uninsured rates and track the knowledge increases amongst each individual to track our progress. In terms of targets, we want to partner and catch the eye of the Dallas County Health Department and local divisions of national health organizations to help with resource development and promotion. We also want to contact and get in touch with the philanthropic organizations and community organizations that exist all throughout Dallas County. This includes the library, the YMCA, and the Spanish-serving nonprofits, which can help with promotion and also funding and resource support. Finally, we also want to get in contact with community leaders and local medias to really help promote the program and also bring community support. This includes using church leaders and Spanish language news outlets to really push our message.
So by being able to partner with community organizations like churches, libraries, and gyms, we're able to partner with them to provide initial funding and resources as well as connect directly with the Hispanic population. We'll highlight personal stories from people who have benefited from health coverage or community programs And then by hearing real experiences helps reduce the stigma, builds trust, and shows others that seeking help is both possible and worthwhile. We'll also focus on recruiting and training bilingual volunteers and community health workers who can serve as trusted messengers. They'll assist with outreach, answer questions, and provide one on one support during classes. To encourage participation, we can offer small incentives like a free meal, childcare, or even free health screenings. And then finally, by creating bilingual posts, videos, and testimonials, we can raise awareness and make information easy to find and understand.
Okay, so these are the action steps that we intend to take to implement this program, and we have them split up in between immediately, 1 month, 6 months, and 1 year, and you can see these listed here.
For our evaluation, we'll use pre and post surveys to measure how much participants' understanding of health insurance improves. This includes their knowledge of coverage types and confidence in choosing the right plan. And then we'll also use qualitative feedback through short interviews or written reflections, which allows participants to tell us if the bilingual materials truly help them overcome language or communication barriers that made enrollment difficult. And then finally, we'll just track outcomes, specifically how many people successfully enrolled in a health insurance plan after the program. Here are our resources. Thank you.